Thank you for making the decision to donate life-saving plasma. Before you donate, this video will provide you with important information that will help you understand the process of plasmapheresis, or plasma donation, understand what happens to your plasma after it is collected, and learn ways to keep yourself healthy as a plasma donor. Before we discuss the process of plasma donation, let's learn what makes up our blood. Blood is made up of red blood cells, white blood cells, platelets, and plasma. Plasma is the fluid portion of the blood. As a plasma donor, you undergo plasmapheresis, which is the process of taking fluid from the body and returning the red blood cells back to the body. Let's learn about how the plasmapheresis process works. The process is performed with a plasma collection machine and sterile one-time use supplies. This means, after each donation, the supplies used in your donation are thrown away, and new supplies are used for the next donor. This greatly reduces the chance for disease to spread from one donor to another donor by donating plasma. During your donation, the following steps occur. First, a phlebotomist cleans an area of your arm. After cleaning your arm, the phlebotomist inserts a needle into a vein in your arm. Your blood travels through tubing, called a harness, and is collected in a plastic bowl. The bowl will spin inside the machine very rapidly. This rapid spinning, or centrifugation, separates your red blood cells, white blood cells, and platelets from your plasma. The plasma is transferred into a plasma collection bottle, and your red blood cells, white blood cells, and platelets are returned to you through the same tubing and needle. When your red blood cells are returned, you will also receive very small amounts of sodium citrate. Sodium citrate is an anticoagulant that is used to prevent clotting during the procedure. At the end of your donation, saline is given to you through the same tubing that was used to collect your plasma. Saline helps replace fluid that was removed from you during your donation. Now let's talk about how often you can donate plasma. Federal law allows you to donate 2 times in a 7-day period, with 1 full day between plasma donations. Here are a few things to consider. If you donate twice a week, you may return on or after your regular donation days, but not before. For example, if you donate this week on Tuesday and Thursday, you cannot donate until the following Tuesday. Monday would be a day too early. Also, while you are part of the plasma donation program, you cannot donate whole blood. Whole blood collection includes red cells, platelets, and white cells, as well as plasma. Finally, you cannot donate at more than one plasma center during the same time period. Here are some things you need to know about plasma donation. Over time, the protein and hematocrit levels of your blood may be reduced. This may require a temporary deferral from the donation program until your levels are back to normal. Next, there is a chance all of your blood cells may not be returned for various reasons during the donation process. This may require deferral from the program for 2 months. There is also a chance an additional needle stick may be needed if the first needle stick fails. While most donors do not experience any problems during donation, there is a possibility that you may have a reaction while donating plasma. You should let an Octapharma Plasma employee know immediately if you feel any tingling in your fingers or around your mouth, or if you experience any muscle cramps. These could be symptoms of a mild reaction to the anticoagulant. Some people may experience dizziness, shortness of breath, nausea, vomiting, and/or convulsions because of the change in the blood volume during or right after the donation. Though extremely rare, some people have experienced allergic symptoms, which include abdominal cramps, wheezing, difficulty breathing, chest pain, flushing, and/or hives. These symptoms could be life-threatening. If you should experience any of these symptoms, please let a donor center employee know immediately. Also, please notify the staff if you know you have allergies to latex, rubber, tapes, or iodine. Now we will talk about what happens to your plasma after the donation. Your plasma will be tested for the following: hepatitis A, hepatitis B, hepatitis C, parvovirus, HIV to test for the AIDS virus infection, syphilis, protein levels, and atypical red blood cell antibodies. If any of these test results are reported abnormal, you will be notified and possibly permanently deferred from donating blood or plasma. You may be notified privately by certified mail. If necessary, you may be placed on a permanent deferral list, such as the National Donor Deferral Registry and local health departments or agencies as required. In addition, blood typing may be performed. There are some things you need to keep in mind about the tests being performed on your blood and plasma. First, there is a chance for a false positive test result. False positive means that a test result suggests that you have an infection. However, further tests by your doctor show you do not have the infection. For this reason, we always encourage you to go for follow-up testing by your personal doctor or the health department for an actual diagnosis. The tests we use are for screening purposes only. There is also a chance for a false negative test result. A false negative result means that our screening test does not identify an infection when in fact one is present in your system. For this reason, we ask that you do not donate to receive free testing, or if you have participated in activities where infection is likely to happen. One of the diseases your plasma will be tested for is HIV, or human immunodeficiency virus. HIV is the virus known to cause AIDS, or acquired immune deficiency syndrome. People with AIDS cannot donate plasma. The signs and symptoms of AIDS include the following: unexplained weight loss, night sweats, blue or purple spots on the skin or mucous membranes, such as the mouth, swollen lymph nodes lasting more than 1 month, white spots or blemishes, rashes, in the mouth, fever greater than 100.5 for more than 10 days, cough or shortness of breath that doesn't go away, and diarrhea that doesn't go away. Another disease you should be aware of is Creutzfeldt-Jakob disease. Creutzfeldt-Jakob disease, or CJD, is caused by abnormal protein that finds its way to the human brain. CJD can cause tunnel-like holes in the brain and eventually causes death. You can get CJD through genetics, a family history of CJD, or through eating beef which is contaminated with abnormal proteins. There are 2 types of CJD, classic and variant. Both are fatal. Classic CJD can take up to 30 to 40 years to affect the victim's health, and the victim will usually die shortly after it is discovered. Variant CJD is usually found in younger people. It only takes 3 to 4 years to affect the victim's health, and they will also die. Currently, there are no tests to diagnose CJD, so we rely on answers to questions to determine who may be at risk for CJD. Remember, it is very important to answer all screening questions honestly. Plasma is made into life-saving medicines. Therefore, we want to make sure only the highest quality and safest plasma is being used. If you remember any information, even after your donation, related to your health or activities, which may require us to destroy your plasma or defer you from donating, please let the donor center staff know. This information is kept confidential. Now we are ready to discuss ways you can keep yourself healthy as a regular plasma donor. Fluid replacement is an important part of being a healthy donor. It is important you drink plenty of fluids that do not contain caffeine or alcohol. It is also important to have good healthy meals before and after each donation. This lowers your chance of having a reaction and helps your body replace the plasma removed during your donation. Caring for the needle puncture site is very important. There is a chance you may have bruising or soreness. This is caused by blood or fluids leaking around the needle site. Keeping this in mind, it is important to follow these instructions. Report any trouble with your needle site to a donor center employee immediately. Keep the area clean, but do not remove the bandage for at least 2 hours after your donation is complete. When you remove the bandage, clean the area with soap and water. Do not touch or pick at the needle site. This could cause additional bleeding or infection at the site. Do not reuse the bandage given to you at the end of your donation. It is important to remember, for life-saving medicines to be made from your plasma, you will need to donate at least 2 times. After today, the donation process will go a lot more quickly, but remember to make sure you come at least once a month. Before we end, let's review what you've learned in this module. At the beginning of this educational video, we told you by the end of this module you would understand the process of plasmapheresis, know what happens to your plasma after it is collected, and learn ways to keep yourself healthy as a plasma donor. If you do not feel comfortable with any of these learning objectives, please ask an employee for assistance. Thank you for making the decision to donate life-saving plasma.